It's sort of a of course I would mentality. I think people that donate organs and you love somebody so much, and anybody that has to watch a family member or a loved one go through the pain and suffering of terminal illness, you just do it without even thinking. So when I did it with my sister, I thought, well, of course, if this can help her feel better or give her a longer chance in life, of course I would do it. I think kidneys are like the forgotten organ. I think people don't really know what they are. I don't think they know what they do, where they are in your body. And so it's something that I think a lot of people just need to be educated on, the importance of a kidney. It's a very complicated organ. Our disease is genetic. We didn't know it the case when I got sick. We were not aware that it was genetic. So it was something that when I came down with the illness, we learned very quickly. I think at first it's sort of like a grieving process, like a death or something like that. You go through various stages of emotion. I think first you think, why? It's like getting hit by lightning twice for our family. An absolute nightmare at first. We already have one sister that's been through such horrible things with this disease, and then for my parents to watch another child of theirs go through the exact same thing, and it being even more magnified because I had already donated a kidney, it just seems like the world's not fair. As hard as it was for me to take an organ from my mom, she had the exact same mentality about it. It was just parts to her. You would have thought she was just running an errand, literally. She did it without even a blink of an eye. My mom is a huge part of our family, sort of the center of our family. For me, for my daughter, for my dad. And so the thought of putting her at any risk is a hard thing to do. People that are for it do it, as little as putting it on your driver's license to say, I want to be an organ donor, or letting your spouse know, or letting your parents, if you're a young person, know that that's what you want in the time of an untimely death. The amount of organs is what slows this process down, and what people are dying waiting on a list for it. And I think if there was just more people willing to, it could save so many lives. And I always think of the children. I'm a mother, and so I always think, God, if my daughter was on a list just sitting there waiting for a kidney, I can't even imagine. With any rare disease, you have to look for answers. So I think that we just never settled for what answers we got. I just looked and looked, and I started reading every medical journal that had to do with my disease and my scenario, and I kept coming along the same names. And the doctors here at Iowa were among the top that I read on everything when it came to rare diseases, especially mine. I think for patients, they just need to be their own advocate and look for answers, and don't settle. If you know something's not right, if you know that you feel like there's answers out there, or that you're hearing that there are, you have to look for it. The physicians here are, I can't speak highly enough about them, absolutely spectacular. Dr. Thomas, Dr. Reed, Dr. Nestor, they are the most responsive physicians I've dealt with. I literally emailed Dr. Nestor and got a response directly from her within 10 minutes when I first was sick. And she responded directly back to me. And I mean, some doctors, it's hard to get responses back in a week. So the fact that they're some of the busiest physicians in the country, and that are doing research that is cutting edge, and they have time to respond to a patient that quickly, that's just a testament to the kind of people they are, and the amount of time they take, and the care that they have for their patients, let alone the process that we went through when we came here for the procedure. I mean, the entire process is so streamlined that I don't understand why everybody can't replicate it. That's my hope for healthcare for the future, is that somehow across the country that people will take models like the one that exists here at the University of Iowa and duplicate it everywhere, because it not only is more streamlined from a financial standpoint, but from a patient care standpoint, it's absolutely incredible. When you come, just even for a visit, you'll know. I've never felt safer. I've never felt more at ease in my life. The doctors feel like family now. The nurses cared for me as if they were my own family. I think the best thing to say to people coming here is just come visit and you'll see. To my transplant team here, to the nurses, thank you. I most definitely would not be here without the advice and the guidance and the opportunity. Thank you for taking me without even blinking and making it so easy, for helping me negotiate through the process, holding my hand the entire time. It saved my life. And thank you for taking such good care of my mom. You've given me and my family an opportunity that's irreplaceable.